I'm Dr. Buonassisi. I'm a facial plastic surgeon, and I work with a team of experts here at 8 West Cosmetic Surgery. I've been in practice for 20 years, and we offer a unique combination of surgical and non-surgical treatments for facial rejuvenation. This video is part of a series about the eyes and brows, and in this particular video, we're going to dive into the treatments for the upper eyelids. An upper eyelid blepharoplasty is a reshaping of the skin of the upper eyelid. It's designed to remove extra skin, to tighten up the upper eyelid, and to allow for more exposure of the tarsal platform, which is the little strip of skin above the eyelashes. I would say on average, it's patients in their 40s and 50s that typically are requesting that. We do sometimes have younger patients who genetically have very heavy upper eyelids, but that's probably less common. A candidate is someone who has reasonable expectations for what the surgery can do, does have extra skin that can be safely removed, and doesn't have any significant ocular problems. What's great about upper lid blepharoplasty is that the surgery is really very minimally invasive. We're really, in most cases, just removing skin. The incisions are hidden in a natural crease, so it's just the best way to camouflage the incision. It's relatively pain-free in the recovery period. And I think often patients see a really big improvement without having a huge investment of time and recovery. So I think it's very popular because it works very well, and the recovery is very easy. There's really two types of upper blepharoplasties. One where we're removing not only skin and muscle, but also orbital fat, and typically that's in our older patient population. And I think what's more common in our practice is called a sliver blepharoplasty, where we're really being very conservative about removing skin only and maintaining the youthful fullness of the upper eyelid. The surgery is performed under local anesthetic. Once the anesthetic is applied, there is no discomfort at all. And usually after the surgery, there's really not much pain either. Some people will take a little bit of Tylenol, but that's really all they need. So the skin is marked. We have to be careful to take the right amount of skin. I think that's critical. Once the anesthetic is applied, the skin is removed with a scalpel so that it doesn't damage the skin with heat. The skin is removed, and if fat needs to be removed, that's done at the same time. And then the skin is closed with very fine, delicate sutures. The final incision line is the same line that we all have as a crease. So we have a natural crease that forms in our upper eyelids when we open our eyes, and that's where the incision is placed so that the scar is not visible. Recovery from upper blepharoplasty varies. I think that in some cases, if there's minimal bruising, people will often go back to work the next day. If you're doing video conferencing or working from home, of course, you can do that right away. As long as you're not doing really heavy, strenuous activity, and as long as you don't mind having a small, sort of bumpy incision line when you're at work, I don't see a reason why people couldn't do relatively sedentary work the following day. The non-surgical complements to blepharoplasty include resurfacing of the lower eyelids. So when we do the upper eyelids, sometimes a little bit of wrinkling of the skin can be treated by doing laser resurfacing. And also Botox around the eyes to relax the forehead muscles that cause the vertical frown lines and periorbital areas, along with doing a little bit of a brow lift by placing a small amount of Botox just underneath the brow so that it allows it to elevate a little bit. So those are all things that, in combination with a blepharoplasty, can really rejuvenate the entire periorbital area. In Amanda's case, in addition to doing a blepharoplasty, we also significantly elevated her brow, because I think what she needed in terms of brow elevation is just not possible non-surgically. Stay tuned for other videos in this series where we talk about brow and lower lid rejuvenation.